Welcome to the press conference following the informal leaders video conference on COVID coordination. You might have seen that we have published a statement on behalf of the 27 leaders on our website following the recent attacks in France. I invite you all to switch on your cameras and we turn to the President of the European Council, please.
Thank you. Good evening, everyone. First of all, let me express our full solidarity with France and the people of France on the recent terrorist attacks. I would like to express my deepest condolences to the families of the victims. We stand together, the European family united, for our democratic values and freedoms. Tout d'abord, je voudrais exprimer notre entière solidarité avec la France, avec le peuple français, victime encore une fois d'une attaque terroriste barbare. Nous sommes totalement déterminés à être rassemblés, à être unis, la famille européenne pour défendre les valeurs de liberté, la démocratie et l'état de droit. Je voudrais maintenant en venir au thème de la vidéoconférence ce soir, la bataille contre la Covid-19. Le principal message politique que je veux adresser ce soir, c'est le suivant. Nous sommes rassemblés, unis, parce que nous sommes dans le même bateau. C'est une lutte difficile, c'est une crise qui est sévère, c'est une deuxième vague qui, une fois encore, nous met à l'épreuve et met à l'épreuve nos concitoyens partout en Europe. On COVID now, the numbers are increasing everywhere in Europe. Our hospitals and health workers are again under pressure. And that's why many leaders have announced lockdown and restrictions. In such hard times, cohesion and solidarity matter more than ever. We call on all the Europeans to take care of themselves and of each other. Our thoughts tonight, first, go to all those who are suffering, to the most vulnerable in our societies. To all of them, I want to express our greatest sympathy and convey our support. A big thank you also to our medical teams that are doing an extraordinary job in such difficult circumstances. Today, with the leaders during the video conference, we had the occasion to focus on testing and tracing policies and on vaccines, because those issues are crucial, not only in the short term, but also in the mid and the longer term. We shared our experiences and we discussed how to help each other. Testing and tracing are key to limiting the spread of the virus. It's crucial because it will allow us to better control the situation. We exchanged on how to advance a common approach to the mutual recognition, deployment and use of rapid tests. This would reduce the negative impact on free movement and on the functioning of our single market, which we absolutely need to preserve. Yesterday, the Commission presented a recommendation on testing strategies, and we will work actively on that basis to strengthen the coordination. On tracing, we encourage all Member States to participate in this initiative on interoperability between apps put on the table by the Commission, and another goal to facilitate tracing is the establishment of a common passenger locator form on which we should continue to make progress. We also had the occasion to discuss the possibility of harmonizing the duration of quarantine for those infected with COVID. Nous avons aussi abordé la question des vaccins. Et nous sommes totalement convaincus que sur base des initiatives démarrées par la Commission européenne et pour laquelle la Commission a eu l'occasion de partager avec l'ensemble des leaders les dernières informations, nous devons anticiper le moment où un ou plusieurs vaccins seront disponibles. Et il y avait très nettement une volonté partagée, d'ores et déjà de préparer la coopération afin de rendre efficace la stratégie des vaccins lorsque ceux-ci seront disponibles. principalement autour de 4 sujets pour lesquels nous avons déjà fait un certain nombre de progrès et pour lesquels nous voulons continuer à progresser. Le premier sujet, c'est s'assurer que nous sommes bien d'accord, cela a été répété autour de la table de cette vidéoconférence, pour garantir une distribution équitable entre États membres dans le cadre des contrats qui ont été signés par la Commission dans la perspective européenne et dans le cadre des prochains contrats qui devraient l'être, nous l'espérons, dans les prochaines semaines. Le deuxième point, c'est d'échanger nos points de vue afin de tenter de converger sur la question des populations qui, par priorité, doivent avoir accès aux vaccins. Et nous mesurons bien que chaque État membre ont déjà commencé à préparer cette idée qu'il y a des groupes cibles à traiter par priorité, par exemple les personnes les plus vulnérables, les personnes âgées, les personnes qui ont des maladies chroniques ou encore les personnes qui sont actives dans le secteur médical. Nous souhaitons le plus possible harmoniser dans le cadre d'approches le plus possible en commun sur ce sujet-là. Le troisième point, et c'est très concret, c'est la question de la logistique. Quand bien même des vaccins, nous l'espérons, seront disponibles dans les prochains mois, il y aura un travail logistique énorme pour garantir que l'on puisse déployer ces campagnes de vaccins de manière efficace. Vous savez que certains vaccins qui sont envisagés supposeront le déploiement d'une seule dose. Pour d'autres, il est question d'une double dose. Ça a des conséquences en termes de logistique. La conservation et la température de conservation des vaccins n'est pas identique pour l'ensemble des vaccins qui sont espérés et qui sont envisagés. Ça posera des questions, par exemple, en termes de conservation ou en termes de transport. Et enfin, la communication sur les vaccins. Nous mesurons bien qu'il va être important de déployer des stratégies pour essayer de prévenir la désinformation, pour prévenir les fake news, pour garantir la transparence, pour permettre qu'il y ait aussi des monitorings quant aux effets secondaires, puisque chacun mesure bien que les efforts exceptionnels qui ont été déployés à la fois sur le plan financier mais sur le plan de la recherche doit amener à ce que nous ayons cette fois-ci un ou plusieurs vaccins déployés en l'espace d'une année, ce qui est très rapide par rapport aux pratiques habituelles. En moyenne, il faut 10 ans pour que des vaccins puissent être produits et puissent être déployés. Nous avons constaté qu'il y avait une très forte volonté sur tous ces sujets-là de travailler d'arrache-pied dans chacun des organes européens afin de progresser et avec la volonté politique des leaders d'être personnellement impliqués pour donner les impulsions politiques nécessaires afin que les décisions pertinentes, utiles soient prises et qu'il y ait une capacité d'anticipation qui soit au rendez-vous. We had also the occasion to tackle an important topic, the economic recovery. And this is a clear message. We hope that it will be possible in the very short term to decide on the implementation of the package that we have agreed in July, because we all understand that it's very important to make progress in order to limit the spread of the virus, which is a very important measure in order to limit the economic and the social damage, but it's also important to implement what we have decided. Vous l'avez vu, cette vidéoconférence a été l'occasion, comme on l'avait annoncé il y a quelques semaines lors du dernier Conseil européen, d'avoir un échange de vues et au-delà de l'échange de vues, de rapprocher les points de vue européens sur base d'une conviction. Nous serons plus forts ensemble pour gagner cette bataille contre le virus. Cette crise est une crise douloureuse, c'est une crise lourde, c'est une crise sans précédent qui frappe le monde et qui frappe l'Europe depuis plusieurs décennies. Il n'y a qu'une seule option, celle de se rassembler, celle de se retrousser les manches, pas seulement avec des discours, pas seulement avec du langage, mais avec des actes, avec des décisions pour être au plus près de l'exigence de protection de nos citoyens, pour être au plus près de l'exigence aussi qui vise à être en mesure de relancer nos économies, de soutenir nos modèles sociaux et de faire en sorte que l'on puisse, dans les prochaines semaines et les prochains mois, réaliser ensemble des progrès dans l'intérêt des 450 millions de citoyens européens et en partenariat avec l'ensemble de nos partenaires dans le monde. Je vous remercie.
Thank you, Mr. President. Madam President.
Merci beaucoup. Je condamne l'attaque odieuse et brutale de Nice ce matin. Je suis de tout cœur avec la France. Mes pensées vont bien entendu aux victimes. L'Europe tout entière est solidaire avec la France et nous restons unis et déterminés face au fanatisme. this afternoon, this evening, we have discussed indeed the COVID pandemic and how to proceed. I do not need to repeat in detail my assessment of the health situation because you heard it yesterday during my press conference. I think it is enough to say that it is very serious. Numbers of cases are rising. Numbers of hospitalization are rising. Numbers of death are rising, not as fast, fortunately, because we understand better today how to treat COVID patients and how to deal with the disease. But the spread of the virus will overwhelm our healthcare systems if we do not act urgently. And it is important to act coherent across the European Union, and therefore this VTC was very helpful. So I had 5 messages for the leaders today. The first one is on data sharing. We have to share comprehensive and accurate data in real time with the ECDC platform. This is of utmost importance and it is in everyone's interest because it helps us to know what is going on, to act coherently, to know better about the actual situation, and it helps us to coordinate. For example, if we have more data sharing on ICU capacity and where capacity is lacking, we can increase the cross-border patient care, and it can be organized early enough. So the more countries share information, the better we can coordinate the response. The Commission announced tonight that we are making 220 million euros available to finance a safe cross-border transfer of patients where it is needed. And for that, the good use of the money requires good information in exchange. The second topic was also a topic on sharing, but in this case, experience and analysis. We will launch a platform to bring together the specialists that are advising each national government and the experts that are advising the European Union. It were national science advisors who asked us to do this in order to share best practice and to align science advice to governments across the Union. We're learning by the day, by the week, and also science is learning how to deal with this disease, and therefore this exchange of scientific knowledge on the highest level is of utmost importance, because this way we will learn from each other what works and we will avoid conflicting or confusing messages. The third topic is testing. Our goal is keeping the virus in check, and that goes through massive testing. So we agreed that we need to have quick validation at EU level of the new tests, and this refers mainly to the rapid antigen tests that are currently being developed. They certainly have an important role to play. We have the PCR testing and we have the new rapid antigen tests. We will work on the validation on EU level, because this will then enable us to describe the optimal setting for the different forms of tests, and it will enable us for a mutual recognition of test results across the European Union, and that, of course, is important mainly when essential travel is taking place. The fourth topic is tracing. So testing and tracing go hand in hand. 22 member states have developed a tracing app or are developing a tracing app. The Commission created a European gateway for interoperability between the member states. 3 apps are connected since Monday, and during the month of November, 19 other ones will join this European gateway. At the moment being, we have approximately 50 million downloads concerning smartphone holders, but this is not enough. So we need across-the-board coverage in the European Union, and therefore I asked leaders in each country to encourage a massive uptake by citizens, so a massive download of the app by smartphone holders, and that we must hook up the apps to our gateway so that all apps are communicating and we have interoperability all over the European Union. And we will bring forward a passenger locator form in order to facilitate the tracing during travel. I informed leaders that the Commission will launch a pilot for the passenger locator form in November. So our aim is that we have the passenger locator form on the European level by the end of the year. And finally, the fifth point, indeed, is vaccines and vaccination. We have three priorities here. The first is ensuring validation of vaccines speedily. And we do have to do the validation at a good pace while providing all the safety guarantees that are necessary. So accuracy and speed at the same time is of the essence. I highlighted to the leaders that the European Medicines Agency is carrying out a so-called rolling review of new vaccines. That is, that the evidence is being submitted step by step by the pharmaceutical companies, and it is being analyzed as it comes in by EMA, instead of waiting for the whole file, which is normally the case. You finish the clinical trial and then hand in the whole file. This time we're having a rolling review to speed up the procedure without having any shortcuts. The second priority is to ensure indeed the fair distribution of vaccines to member states. There I have good news. The member states will all get vaccines at the same time and at the same conditions based on their share of the EU population they have. And this is already fixed with the member states who we have already agreed on that. But thirdly, before we really go into the vaccination, indeed the infrastructure for vaccination must be ready. And this is why we ask the member states to send in their national vaccination plans to make sure that they are all fit for purpose. To conclude, I want to stress that I understand how tired and worried everyone is. We are all wondering when we will come out of this crisis. But now is the time for patience, for determination, and for discipline from all of us, from governments right down to each of us individually. All the public policies I have described are important, but the most important thing is to adopt and maintain the right safety habits for ourselves, for our loved ones, for our friends and for our colleagues. Wear a mask, avoid crowds, avoid close contacts, and avoid closed spaces with poor ventilation. That is key. Simply doing this will enormously help in our efforts. And that way, all together, we will overcome the virus. Thank you.
I would like also to mention Turkey, because we mentioned Turkey today. And as you know, we had in October a strategic debate on the Eastern Mediterranean and the relationship with Turkey. We expressed our determination to be respected, and we agreed to work on two tracks, a positive track and a less positive one. We offered a clear way to work towards a positive agenda to Turkey. So far, Turkey has not chosen this path, and we condemn the recent unilateral action in the Eastern Mediterranean, provocations and rhetoric, which are completely unacceptable. We will have the occasion to revert to this topic in December.
Thank you to both presidents. We'll now take a couple of questions. I see many hands raised. Please switch on your cameras. I'm going to start first with Caroline Meta-Beisel. Caroline, you have the floor.
Thank you for taking my question. Oh, I am hearing myself double. I hope. Can you hear me twice as well? I don't know.
We're hearing you perfectly. Just
Okay,
lower
great.
your volume a little bit.
I will. This is a question for Mrs. von der Leyen. During the course of this pandemic, your Commission has already given out several guidelines and recommendations to member states to help them better coordinate during this crisis. Do you wish EU leaders were quicker in following up on your recommendations and implementing those recommendations? And the second question, if I may, are you worried that member states will again close borders, and if not for goods in the common market, then for individual European citizens who want to travel?
What was the beginning of your second question, please?
The second question was if you were worried that member states will start closing borders again, not only for goods, but also for individual Europeans who might want to cross borders. Thank you.
So to start with the second part of your questions, I think we have all learned the lessons of the spring. So I remember very well in the spring when at the beginning most member states looked inward and closed borders, and it took very little time to understand that this is hampering very severely the single market, the flow of goods, and therefore not at all the appropriate reaction. It did not stop the spread of the virus. So this time you see that we've learned the lesson, and you see that the approach is way more differentiated to fight the virus. We've learned how to deal with the pandemic. And for sure, there was a lot of support today for the green lanes that have been established. We announced that we will extend the green lanes not only for roads, but also for air, waterborne freight and rail. This has been a very good step forward, the green lanes, to really protect our single market, and this is very important for our member states. The second or the first part of your question, here too we have seen a learning process that by now member states ask for the recommendation, we work on them, deliver them, and in a very timely manner then they are implemented in the member states. We have to understand that in the health topic the competences are with the member states, so it is a classical approach to have these recommendations, then to have them implemented in the member states. I think that the regular information we have at the leaders level are very helpful to have a coherent flow of information too. So if we proceed this way, I'm very satisfied with the situation.
Moi, je voudrais ajouter ceci sur cette importante question. Tout au long de cette crise qui a démarré avant l'été, à plusieurs reprises, le Conseil européen, s'agissant de compétences qui principalement sont nationales, a souhaité que la Commission mette des propositions sur la table afin précisément de favoriser la coopération, la coordination. Depuis le début de la crise, à plusieurs reprises, des orientations ont été exprimées par le Conseil européen. Il en a été ainsi sur les questions économique, par exemple, sur la relance économique, la demande a été formulée à la Commission de mettre sur la table des propositions au départ desquelles on a pu, au mois de juillet, s'accorder. Il en va de même sur la question de la chaîne d'approvisionnement. Il en va de même sur la question du marché intérieur. Et aujourd'hui, ce qui était très remarquable dans cette vidéoconférence, c'était la volonté très largement partagée par l'ensemble des leaders de tout faire pour préserver la force du marché intérieur, pour garantir les chaînes d'approvisionnement. Donc on voit bien que les premiers réflexes du tout début de la crise, lorsque quelques pays effectivement avaient fait le choix de fermer des frontières, ou bien même à l'époque, vous vous en souvenez, de décider un certain nombre de restrictions en lien avec les exportations liées aux matériels médicaux, on voit qu'ici, il y a le souhait, même si ça n'est pas simple, même si la compétence est principalement nationale, de faire fonctionner les institutions européennes pour faire en sorte que l'on puisse développer des coopérations, des coordinations. Ça n'est pas simple, c'est difficile, on fait face à un virus qui n'a pas encore révélé tous ses secrets, on fait face en ce moment même à une deuxième vague qui est très brutale, qui est très difficile, qui nous contraint dans beaucoup de pays à prendre de nouveau des mesures intenses, restrictives de liberté. Souvent ce sont des lockdowns partiels qui sont instaurés, mais on voit bien que l'on veut progresser dans les semaines et les mois qui viennent, notamment sur la question du testing, du tracing, sur la question des vaccins, qui sont les passages obligés pour retrouver le contrôle de la situation.
Thank you. Moving now to Daniel Weber. Daniel Weber, Radio 100.
Yes, I'm here. Thank you. Thank you very much for the floor. My question, I have two short questions. The first one is on the passenger locator form. Mrs. von der Leyen, you said that the Commission will launch a pilot and that the form should be ready by the end of the year. So my question is, what are the difficulties to get ready with this form? Why does it take so long? That's my first question. And the second question is on vaccines. The Commission already presented a strategy on that. What was the feedback today of the member states? Will they follow this strategy? What was the feedback? Thank you very much.
Yes. So there are currently 11 member states that have already developed a digital passenger locator form at national level, and they are not interoperable. So they are non-common standard and uncoordinated. And of course, if it's supporting travel, necessary travel at the moment being, but then it should go cross-border and all over the European Union. Therefore, the pilot is on connecting those existing, but of course encouraging the other member states also to come up with their PLF. It's a decentralized approach that is very important because that has a lot of trust. We made good experience with the decentralized approach with the tracing apps. It is very important that we have the passenger locator form not at the moment so much because we do not encourage travel, but when things get better and necessary travel is being picked up again, then it is extremely important after the experience in summer that we can track and trace the different persons if there is an infection that is taking place. And your second question concerning the vaccines, here indeed it was very well received. First of all, that we provided a blueprint for a vaccination strategy. So who should be vaccinated first, what group? Healthcare workers, the elderly, comorbidities. The Commission, with scientific advice, has put forward a blueprint, but now we are asking the member states to implement that in the member states, and this was very well received. The second point is that member states were eager to hear where we are at with the coverage of options for vaccines. Here we have contracts with 3 companies. We are about to have contracts with another 3 companies and are in good talk with a 7th one. So this would cover basically the European market, the production in the European market. And here for member states was important to have the reassurance that we have a fair distribution system in place already and that they get at the same time and at the same conditions the vaccines. And indeed, the important point is then the third topic, the infrastructure they have to build up now. Vaccines will come step by step, if I may say so. So we do not know which will be the first one, and we do not know at the moment being how successful vaccines will be. In other words, how much immunization they're able to provide, whether it's 50% or 70% or up to 90%. And therefore, we have to keep in mind that it is a stepwise approach to immunity that we will experience with the vaccines, and this was a broad topic tonight too.
Thank you. Passing the floor now to Andrzej Matiszek from Pravda. You have the floor.
Yeah, thank you, and good evening. Andrzej Matiszek, Slovakia, David Pravda. My question would be for President Michel, and I would like to ask you, Slovak Prime Minister Mr. Matovic said that he will brief readers about Slovak experiment using nationwide antigen testing. So could you please describe this intervention, maybe if there was any discussion about it, and if any country said that they would like to follow Slovak example? Thank you.
Indeed, the Prime Minister explained what's the strategy in his country regarding the rapid test. And indeed, in many countries, there is an interest for the rapid test, because we have the impression that with the PCR test, those new rapid tests, and that's why we are in favor of a mutual recognition, can help in order to develop a global strategy. Ursula von der Leyen just explained how important it was, and it is, and it will be, to develop a strong strategy regarding the vaccines. But we know that the vaccines will not solve everything immediately. We will need, in parallel, to be more efficient with the testing, with the tracing. And the Prime Minister explained that he will share with all the colleagues, with all the member states, the outcome, the results of his strategy and his project to organize on a very broad basis testing in order to be able to isolate and in order to share with us after that the data, in order to share different experiences and to try to make more progress everywhere in Europe.
Thank you. We'll take a last question from Naomi O'Leary. Naomi, from the Irish Times.
Hi, thank you very much for taking my question. So just for the Commission and President Ursula von der Leyen, you said that you don't encourage travel now, and that it's very important that testing and tracing should be in place for when things get better. In hindsight, was it a mistake to encourage the resumption of tourism in your Reopen EU plan, given that we can now see through, for example, genetic examination of the strains of COVID-19 that travel between states fueled the resurgence that we're seeing now? Was that a short-term economic policy in hindsight? Thanks.
So I have not understood all the parts of the question, but I have understood that it is about the travel and the question whether it is appropriate or not. Unnecessary travel, of course, is inappropriate in the situation we're in at the moment being. It should be reduced to really necessary, essential travel. And you asked for how do we judge on the situation looking back? So what we've seen and what we've learned is that after the decrease of the first wave during summer, we obviously have relaxed some measures too rapidly. And it is not only a question of travel, for sure not, because you've seen in the whole discussion we had over the last weeks, but also tonight, that there are many variables that are crucial for keeping the virus down. And what we have to keep in mind is that we will have to fight the virus and we will have to keep the spread of the virus low till we have enough immunity through vaccination in the population. So we'll have to be very careful with lifting measures and keep in mind the most powerful instrument we have in our hands is how we behave ourselves. This is masks, this is social distancing, and this is do not stay in closed rooms with poor ventilation. Those three things are of utmost importance to help to keep the virus down.
Moi, je voudrais ajouter un point pratiquement plus philosophique sur la bataille que nous menons maintenant. Il y a en tout cas un enseignement qui est apparu encore aujourd'hui dans cette vidéoconférence. C'est l'idée qu'il ne faudrait surtout pas commettre l'erreur d'opposer la mobilisation pour la santé et le développement économique. Nous faisons l'analyse que l'on doit donner cette pleine capacité à préserver la santé de nos concitoyens. On doit être totalement mobilisé mobiliser pour faire reculer cette menace, pour limiter la propagation du virus. Il y a des instruments que l'on peut mobiliser, les gestes barrières, la distance sociale. Il y a une responsabilité personnelle de chacun d'entre nous. Chacun d'entre nous, nous avons un petit morceau, une petite partie de la solution en tentant d'être aussi responsable qu'il est possible. Et puis c'est aussi le rôle des autorités de réussir cette bataille pour la santé, parce que ce sera la meilleure manière de faire en sorte que l'on puisse rebondir positivement sur le plan économique et sur le plan social. Et je pense que ce message est un message très important que l'on doit adresser à nos 450 millions de concitoyens européens. La première mesure pour soutenir la capacité de déploiement sur le plan social, sur le plan économique, c'est de réussir à faire en sorte dans les semaines et les mois qui viennent que l'on puisse être réellement en mesure de garder ce virus sous contrôle autant qu'il est possible pour pouvoir alors redémarrer une activité économique au bénéfice de nos citoyens partout en Europe.
Merci, Monsieur le Président. Thank you, Madam President. This concludes our press conference for tonight, and see you soon. Thanks for joining.
Indeed, the mask.